The June 27th, 2017 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown is excused. Dr. Carbone? Mrs. Conley is excused. Mrs. Draw? Here. Ms. Harris is excused. Mr. Hebert? Here. Mr. Lightfoot? Here. Mr. Moyo? Here. Chairwoman Taylor?
Here.
President Daniele?
Here.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? The next item on the agenda is the approval of minutes. You have the May 23rd, 2017 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 17-0192.
Moved by President Daniele, seconded by Legislator Draw. Is there any questions? Legislator Muyo.
Thank you, Madam Chairwoman. Through you to the administration, I have kind of a process question about this referral. It seems as though we're doing two things with this. One is okaying a grant in the amount of $310,000 and some change, and the other is approving a contract with the University of Rochester. Are they somehow connected?
Through the chair, this is Mike Sayers from the Department of Public Health. Yes, we're using the grant money to fund the contract for the University of Rochester. The contract is for a medical countermeasure consulting contract, which is part of my office's mission, is part of the Office of Public Health Preparedness.
Thank you. So through the chair, $310,593 is the grant amount that is then going into a contract for Health Research Incorporated. Are they then paying the University of Rochester the $22,000, $525, through the chair?
Through the chair, the county establishes the contract with the University of Rochester, and as the money comes in for the grant, we will pay the contract invoices.
Okay, thank you. And what, through the chair, what's going to happen to the $288,000 that's remaining?
Through the chair, that funds the rest of my office, including partially my position and several of my other office members, as we go about our overall mission of planning, exercising, and training in our mission of public health preparedness. So this contract is a small part of our office, but has enabled us to sustain and increase our capacity over the years as the money has existed to increase our capacity to respond. Just one example, I used this in the last time we did this contract. Part of it is medical countermeasures, which is giving medication or medical supplies to our community in time of need. During just the recent windstorm in March 2017, we used our capacity built up through this contract to request oxygen concentrators, hospital beds, and cots that help serve our residents in the various shelters throughout the community.
Sure. Thank you for that. I'm not really questioning your work. I was a little confused about the structure of this referral, so thank you for that. I do have one more question. It appears, through the chair, it appears that, I guess I'll ask this question through the chair. Are we in a contract currently with the University of Rochester in the same manner that we're approving here?
Correct. So this contract extends for the entire year period, but I have two grants from two different sources. And when one grant covers, in this case, approximately 8.5 months of the contract, this other grant will pick up the rest for the remaining part of the grant year. So our grant year normally transpires from July 1st through June 30th from year to year. And my prior grant, that is through a state Homeland Security grant program, paid for up to March 15th. And this grant is picking up. Each year, sometimes the numbers fluctuate a little bit. And we just try to balance it off to make sure we have the amount of money properly for the entire year.
Okay, thank you. You've answered all my questions.
President Daniele?
Yes, Madam Chair, through you to the administration. I noticed that this grant is coming from a corporation called Health Research Inc. Who is Health Research Inc. and how is, where does a corporation, what's their role and how do they end up giving out a grant?
They're affiliated with the New York State Department of Health, through the chair. They're affiliated with the New York State Department of Health. And this is a CDC grant that is processed through HRI, which is an arm of the New York State Department of Health. And they award it pretty much based on a per capita basis throughout the state. So as a large county, we get more money than a smaller county. So they serve as the arm of the New York State Department of Health to help process all of the invoices that we send back for reimbursement and things like that.
Thank you.
Is there any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0193.
Moved by legislator Draw, seconded by legislator Hebert. Is there any discussion? Legislator?
Thank you, Madam Chair. I think I have a rather simple question. This is for a 3-year grant for $211,000, $833. Is the funding for that spread over the 3-year period? So approximately $70,000 a year through the chair?
Through the chair, this is Kathy Carlock from the Department of Public Health. Yes, that's correct.
Okay, thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0194.
Moved by legislator Hebert, seconded by legislator Carbone. Is there any discussion? Legislator Draw?
You, Madam Chairwoman, through you and to the administration, Monroe County, I believe, had a similar program in the past. Is this similar to the OASIS program that we did before?
Through the chair, yes, this is similar to that program.
And why is this just a new, can you explain why we're going with this program?
Sure, through the chair.
Through the chair.
Originally, when this program started, it was done in-house as a direct service of the Monroe County Office for the Aging. It then was subcontracted to Genesee Region Home Care for the OASIS program, which is an evidence-based program. When procurement looked at the type of programming, they asked us to solicit to that they didn't think it was sole source necessarily because there were components of it that could have been done by other provider agencies.
Okay, thank you.
Did you have a question, legislator?
I'm sorry, I couldn't hear all that response. There was some noise out in the hall. So forgive me, through the chair, this is a new organization that's providing these services? Is that correct?
Through the chair, no, this is not a new organization. When procurement looked at the previous sole source, they thought the components of the sole source could be activities and services that another provider agency may want to do, and so they asked us to develop a scope of services and issue an RFP.
Okay, thank you. I have one more question through the chair. How are seniors or other residents notified about these programs? Is there an advertising campaign? Is it at local community centers? What's the nature of the outreach?
Through the chair, they do have a developed catalog of all their programs and services. They solicit those in various distribution sites across Monroe County. Senior centers are one of the sites, as well as area grocery stores and other entities across the county.
Thank you. And through the chair, is your office satisfied with their outreach? Do you think that there's more that could be done?
Through the chair, they've done a wonderful job with the program in the past.
Okay, thank you.
Any other discussion? Okay, being none, All those in favor, please signify by saying aye. Any opposed? Any item carries. Are there any other matters to come before this committee? There being no other matters, the June 27th, 2017 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, July 25th, 2017, at 5:30 p.m. Thank you.